Alright, hello everyone. So today I've put together a little video about, just in response to comments that I've heard from people who might be newer or not as experienced when it comes to teaching, that a learner turns up to their clinic or on their ward or in their operating theatre and they're not really sure what to do or how to approach that. And sometimes you just feel the panic start bubbling up. Well, please don't panic. Today I'm going to walk you through exactly what to do if there's a learner, a student, a resident, whoever in your clinic. So the first most important thing to do is breathe. And remember, the learner is likely much more nervous than you are to be there, right? New environment, steep learning curve. This is your natural environment, right? This is somewhere that you work regularly, that you feel comfortable in. And just remember that this learner is likely more nervous than you are about the situation. So, with that said, don't forget our social niceties, right? Developing that educational rapport, that educational alliance between teacher and learner is very, very important in those first few moments. Really are defining in forming that relationship. So, start off with something like, hello, I'm Dr. Peretti. What's your name, right? Who are you? In a nicer way. And even, who are you and what are you doing here? Again, not using those terms, but when I have a learner in clinic, I always like to make sure that I get their name, so I know what to call them. Stage of training, right? The way that you approach teaching or your expectations for a first year medical student are going to be very different from a final year fellow, right? And then interests. And my interest, specifically, I'm referring to interest within medicine, right? A medical student who is interested in going into surgery, I'm going to approach very differently from a final year fellow who's specializing in my subspecialty of interest, right? If you have time and you feel up for it, you can also add some non medical interests. I've certainly worked with people who introduce themselves and say, outside medicine, I like yoga and running, or I like, to try um, taco stands wherever I travel, for example. And that can just help with humanizing the relationship as well, although it's certainly not necessary, especially if you feel a bit uncomfortable. So after you've gotten the introductions out of the way, you're going to want to assign the learner a level appropriate task. And this can vary by stage, and sometimes this can be a bit of a trickier situation. So I've put together some sample tasks both for medical students and residents or fellows. If you're ever not sure, you can ask the learner, say, do you know what you're supposed to be doing this rotation? What are your learning objectives, right? What do you want to learn from this rotation? That might help you assign them tasks. Now, in general, for medical students, they are learning where they should be able to take a basic history, perform a physical examination. Maybe a more advanced medical student can look at some of the blood work, some of the investigation results. And I like the students to at least attempt a management plan or diagnosis. Now, depending on the stage and the interest of the medical student, I might adjust my expectations, but it's a good exercise for them to at least try. Now, resident or a fellow, they should have obviously a bit more um, narrowed skills towards your discipline, given that they're probably doing some specialty related to it, if not that specialty in particular. They should be able to perform an accurate assessment of the patient, depending on the field, depending on the setting, starting preliminary workup or treatment, and you would expect a much more detailed differential and management plan with more accuracy as well. When you have the learner in your clinic, as they're doing their tasks, you want to teach them something, right? And I have some other videos on my channel here, things like 1 minute preceptor, where if you're newer to teaching, these are really easy models for you to incorporate in your teaching practice until you get more comfortable and you can come up with your own approach. Then monitoring and debriefing as needed. So it's important to pay attention to your learner, right? If I have a learner for a day or for a couple of days, I like to pause usually around lunchtime and check in with them and say, how are things going here? Are there things that you'd like to be doing differently? Are there things that you would like to be learning or trying to do that you're not doing? right? And then depending on your field as well, you want to keep tabs on that learner. So I work in oncology. It's a very high stress, high emotion field. And it's important for our learners, especially our junior learners who may not have the coping skills to work in such an environment, that we're keeping tabs on how they're feeling and how they're doing, checking in, debriefing about difficult situations, and making sure that they, if they need a break or they need a timeout, that we make that available to them as well. And then finally, saying thank you at the end, right? Learners at our clinic, they are helpful, right? They're doing some kind of work, even if it's just taking histories, doing physical examinations on our patients. So making sure we take time at the end to debrief, to get feedback, right? Often, and that's what I mean by plan, often there's paperwork or evaluation that the learners will need. Also, find out if they're planning to come back. So maybe you can plan some teaching activities for when they come back. Find out if there's something different that they want to see when they come back. And that, in a nutshell, is an approach if there is a learner in your clinic.